Welcome to this pharmacy ownership video on services in your pharmacy. This video will talk about the importance of building a strong operating model. Dispensing is an essential service and forms the core workload for the majority of our pharmacies and community pharmacy as a whole. If your dispensary operations are inefficient, then extra workload or growth in your business can cause more disruption than profit. Efficient dispensary operations allow growth to be managed as well as encouraging profit. What would you describe as a strong operating model in your store? Take a moment to reflect. Here are a few of our suggestions. All colleagues should be trained and competent in dispensary processes. Prescriptions should be ready for collection as agreed with the patient. Deliveries arranged when appropriate. The dispensary should be clean and tidy and organised. All activity in the pharmacy follows a set process every single time. Patients feel the team are knowledgeable and care for their needs. Prescriptions have a fixed prescription journey, allowing for queries and issues to be clarified quickly. And the pharmacy is unlikely to lose a prescription. All of these factors can be considered part of a strong operating model, but you may have thought of some others. Let's look at an example store to understand more. Store A is a local pharmacy set within a small town. It has a long-term pharmacist store manager and a small team. However, SOPs are only partially implemented and new SOPs are not implemented in a structured way. Responsibility for some tasks, for example, end of day, lies with one or two members of the team, so other colleagues don't understand the process and can't do it in their absence. There is no clear process for managing repeat prescriptions or communicating with the surgery. Each colleague does it their way. The lack of prescription journey makes it more complex to address customer queries. Each member of the team has different tasks within the day, with no understanding of what their colleague is doing. This means there's also no crossover or handover of work, and it can cause issues when certain colleagues are on annual leave or day off. And it can also cause problems when dealing with patient issues. The dispensary isn't tidy, jobs are left half done, to be completed when someone returns from their break or the next day. There's also no communication book to pass on messages or ensure tasks are followed up. However, the setup seems to be working for this store. Patients tend to be happy with the service they're receiving, prescriptions are being dispensed on time, and the month-end process has been submitted. Suddenly, a GP surgery in their area relocates next door. The pharmacy is suddenly receiving a huge increase in business, especially with walk-in customers who want to use the pharmacy's services. Some tasks remain completed on time, for example, dispensing a prescription for a walk-in customer, but other activities are being left behind, for example, ordering specials and checking out-of-date medicines. The store calls in extra resource to support with the extra patient workload. However, the new colleagues learn the same bad habits as the old ones. Prescriptions remain unendorsed, relying on other members of the team to complete this. Customers' prescriptions still aren't ready when promised, and the dispensary very quickly becomes unorganized. The prescription journey isn't clear, and patients become increasingly unhappy with the service. More importantly, the store environment becomes high risk for a patient safety incident. The environment has caused low morale within the team, and they are feeling quite stressed. So what's gone wrong? The previous operating model in the store was inefficient and unbalanced. A small part of the team were taking a disproportionate amount of work, and responsibilities were unequally distributed. By not spreading good practice and ensuring all members of the team had the same capability, the tasks remained undone as the business grew, and there was no accountability for these tasks. As the store's items business has grown, the disparities have caused larger problems. Because the store manager hasn't rectified the workload issues, the cracks in the operating platform have become more and more apparent. The result? Prescriptions are not dispensed on time, so patients are unhappy. The workload is not being managed in the store, so the store team are feeling under pressure. Additional tasks are being left behind, so the store becomes increasingly unprofitable. This example is an extreme example of growth and the very immediate impact on a poor operating platform. However, this is often seen over longer periods of time. The lack of accountability within the team and the lack of strong leadership and responsibility within a store can mean that it often feels busy, but the store is not generating any profit or making amends to the operating model itself.